I am Dr. Heather Moore, owner of Total Performance Physical Therapy, and tonight we are going to discuss how to eliminate back pain when you're playing golf. So, little known fact about me is that I actually used to work on the PGA. So, we would take our little golf cart and ride around to the different holes and follow the golfers, and then there would be a very lovely trailer off to the side where we would see players before their rounds, after their rounds, but no pressure existed like having a golfer go down at a hole. So we had a couple of tricks in the bag that we would teach the golfers or work on them with so they would be able to solve any back pain that they had. I know it doesn't work for Tiger, but he seems to be coming back, so that seems to be going away more rapidly now, as it was not so much before. But it is not uncommon for players to get a spasm when they're on their course, or for players to be in back pain when they're on the course. And what they don't show you when you're on TV is that we kind of rush in and we're doing our magic, so to speak, as much as we can, tape them together before we can actually get them into treatment in the days following. So a couple of things that we're going to go through when we talk about back pain. First thing I want to talk about is your swing. And I'm not a swing expert. I have a very funny story about Tiger Woods' golf coach. I went golfing with him one time, and what he told me about my swing, which we won't say on a live Facebook post, but yes, so I'm not a good a golfer, and I don't have the best swing. So, but what I do want to talk to you about, and there's swing coaches out there, like I would hire one immediately. When you suffer from back pain and there's any type of back issue going on, or vice versa, there's a shoulder issue going on. Golf is a lot of rotation, so everybody takes out their club and they do a lot of this when they warm up, which is great. But if you don't have rotation, let's say you're not able to get all the way around in your shoulder, you're going to find that rotation somewhere. So if you're not able to rotate through when you're coming back in your shoulder, you're going to get that rotation in your low back. All right, so you're not going to wind up shortening your stroke. You may, but many times what happens is people who can't rotate all the way in their shoulders, and I am on the tighter side, will actually wind up getting that rotation in their low back. Or people who can't get the rotation in the low back will actually wind up getting it in their shoulders, and this is where a lot of the problems come along. And this is why sometimes swing coaches get frustrated, or we would work with swing coaches on the tour that would just say, oh my gosh, I keep telling him over and over and over again to do this or to do that, and he doesn't seem to get it. Well, it's not that he didn't get it or she didn't get it. It's the fact that their body wasn't able to get into the position that they needed to in order to be able to do the swing. So if you're restricted in your range of motion, when you're rotating back and forth, you're not going to be able to get into, if your swing coach wants you to rotate a little bit more back, or wherever he wants your arm or your shoulder. Your body's going to invent ways of doing that, and it's not going to be correct, and it's going to be why you hook the ball or slice the ball or whatever it is you do. It's usually because your body is not able to get into the correct position to maintain perfect alignment. So you want to make sure that when you are, if you go into spasm or you have shoulder pain or you have an issue, you're not fooling yourself and thinking that, oh, you know what, I just have to work on my swing a little bit more. That's part of it. But if you are not able to get into the position that you need to with your swing, then that is 90% of the problem. And what we would see a lot on the tour is that they would over-rotate with either their low back or their upper back if they weren't able to get to where they needed to be. So another point I want to make is you will get there. You will find where you need to be in your swing, but you're going to do it using improper muscles. So you're going to do it using the wrong movement patterns. And this is where the pain comes in. And this is why when you're coming around and you're swinging and your low back goes into spasm or your upper back goes into spasm or you wind up with shoulder pain after a round of golf, This is the reason why, is because you are finding your swing inappropriately in your body. You are making your body do things it shouldn't be doing because you're trying to get this perfect swing instead of working on your body in order to be able to get the perfect swing. You're working on the swing, trying to force your body into doing something it can't. So your body's not going to do it. If you don't have rotation for whatever reason, it's not going to happen. So, just make sure that you're aware that those factors exist. And if you have been going to a swing coach and you're getting frustrated, or you've been working on your swing and you're getting frustrated, most of the time it's not your fault. It is the product of the fact that you don't have range of motion needed to achieve that swing. So if you sit all day at your job, or you're stiff, or if you're someone who wakes up and you're stiff, I could 100% guarantee you that you don't have the range of motion in your body to be able to swing appropriately, and that's why it keeps going left, it keeps going right, you keep duffing the ball, whatever it may be. So the first exercise I'm going to show you how to do, and again, these are things you can do on the course. You can do these every day, and you should do them every day. They're just gentle activities. They're not designed to be strengthening. That's a whole other component of golf that we're not going to get into, but these are going to be some exercises that you can do just to loosen up your back, your upper back, while you're on the course, while you're at home. So the first one you're going to do is just going to start in a quadruped motion. So you're going to start on your hands and knees, and you're just going to lift your arm up, okay? And then you're going to thread it through the other arm, okay? Nice and easy, continuous motion, okay? Nothing too bad. You want to try and get your shoulder to the floor, all right? So up and then through, all right? Ideally, you want your shoulder all the way down on the ground. If that's painful, do a couple repetitions. Don't stop just because it hurts. Go a little bit less into the range of motion. Find the spots where it doesn't hurt. And then you can progress from there, a little bit more rotation. However, if you wind up doing 10 of these on each side and you're still getting pain, that's an issue that you need to have resolved. That's when you come in, that's when we take a look at you, because there's problems going on there. There's something that's preventing you from achieving full range of motion, from achieving that pain-free range of motion. And if you aren't able to get it in a simple movement of just rotating your arm back, you're not going to be able to get it on the golf course. All right, so the next one I want to talk about is, we're going to talk about is a pelvic tilt. So all that is, and you can do this is a very easy one to do on the course. And, a lot of times when you lean forward, your butt kind of sticks out and you got this big curve in your back, okay? You can just practice this. You can take the golf club, you can lay it on your back, and you can try and push your back into the golf club. That's going to immediately take some of the pressure off of the low back. A lot of people, if they can't get rotation, are going to arch their back. Again, these are very subtle things that you are going to see happen. These are not major things that somebody's going to be like, oh my gosh, what are you doing? Except for a swing coach and somebody who knows mechanics. But your buddies that you golf with, or the women that you golf with, or whatever, they're not going to be able to tell that you're doing these things. So don't, I'm going to show you an over-exaggerated swing, but it generally doesn't look like that. So you're going to just rotate back, okay? Now, when you're rotating back, a lot of times this will happen, and you're going to get this big curve in your spine. You want to flatten that out. So while you're standing at the tee box, while you're sitting in the cart, all you have to do is just tuck your pelvis under. A lot of people can't even do that. That should be sign number one that something's going on. A lot of people have to do this in order to tuck their pelvis under, all right? It's almost like a crunch, okay? But you should be able to keep your legs still. It's not a big movement. And if you have tightness in your low back, you're going to kind of crunch, and you're going to be like, oh, I feel a little bit of a stretch. And that's totally fine. So, again, if you have pain or that elicits numbness and tingling, that is not a good sign. So you do want to get that treated. You do want to get that looked at. And the good thing is insurance will cover a lot of this for people. So a lot of people don't wind up, oh, my back only hurts when I play golf. Well, that's a big red flag that something's more coming. So, You know, a lot of times this is very much something that insurance will cover just to get you back on the golf course pain-free. But when you're down and you're golfing and you're arching your back or whatever, you're not having enough rotation to get around and you arch your back to get your shoulder back more, you're going to wind up with spasm. You're going to wind up with that low back pain. The final exercise I'm going to show you is just a hip opener. So this is one you can do while you're riding in the golf cart. You're just going to put your ankle over your knee and sit up nice and straight. Golf is, you know, it's in the hips. It's the old Adam Sandler movie, Happy Gilmore. If you've seen that, it's all in the hips. It is all in the hips. So if you put, first of all, if you try and put your foot up here and you're one of those people that has to go like this to get it up, that's a major issue. All right, I can tell you right now your golf swing and your golf game is suffering because you can't even put your leg up here without having to reach down and grab it. That means your hip is severely limited in strength and in range of motion. So that needs to be addressed. But when you do, and you sit down and you're in the cart, or you know, you can sit down on a chair or whatever, you want to make sure that your leg, your knee is down. Okay? If it's up like this, that's a problem. Okay? Or if you have to hold it here because it's going to slip off at any second, that's an indication of a problem. So you want to make sure that you can sit up nice and straight. Your knee, don't push it down. There's no need to do that. Just hold on to your ankle if you need to be. Rest your hand here, whatever. But you just want to sit up nice and straight and you want that hip to open up. Okay? You want to hold this about 30 seconds, all right, until the next hole, or you can switch sides. Another indication that there's a big problem going on is if the sides don't match. So if you do this on both sides and one side's up here and then one side's down here, that's an indication that there's some issues going on. Your golf swing is suffering. I don't even need to look at your swing. I know you don't have the mobility to be able to swing a golf club effectively. So this is how your hips should look, all right? You should be able to put your ankle on your knee with no assistance, no grabbing, no having to hold it there, no grunting. It shouldn't be up here, and both sides should be equal. If you have to push your leg down to get it down where it's parallel with the floor, that does not count. That means there's an issue going on. So you want to look for all these factors. The hips are a major, major player in why a lot of people wind up with pain or back pain while they're playing golf.